welcome to the Chinese Medicine Podcast with Marie Hopkinson. I'm a Chinese medicine practitioner, and today I'm going to be talking about acupuncture and answering the question of, does it hurt? This is a common question that lots of people ask me in my practice, and a lot of patients or just people that are interested in acupuncture in general want to know whether it hurts or not. Of course, if a needle is maybe going to be stuck into you, you want to know whether it may hurt you or not hurt you. So I've got a few little acupuncture needles here today, and I'll show you how they work. So basically an acupuncture needle is a very fine needle. It's made of metal, and you've got two parts of the needle. One part is the shaft of the needle, which is this flexible sort of part that you can see here. And if you can have a look at my fingers there moving, the shaft of the needle, it's very, very fine. And then the other part that you can see sticking out is the handle of the needle. So that's this sort of metal part here that you can see. So the practitioner will hold the handle of the needle and insert the shaft of the needle in there. Now, if you imagine this is a tube, like this is a modern invention for acupuncture, or what they call a guide tube. If you imagine this guide tube as the shaft of a hypodermic needle, which it isn't that thick, but an acupuncture needle can actually pass through the shaft of a hypodermic needle. That's how thin and fine the shaft of an acupuncture needle is. So firstly, what you have to understand with acupuncture is it's nothing like having an injection. You shouldn't feel that kind of level of pain. Most people will feel a sensation when the needle goes through the skin, and some people feel nothing at all. Our aim as acupuncturists is to make your experience pleasurable and relaxing, not something where you would feel uncomfortable. So if you are feeling uncomfortable at all, you should definitely tell your practitioner so that they can adjust the sensation of the needles. So to answer the question, does acupuncture hurt? No, it shouldn't hurt. It shouldn't cause pain, but it will cause a sensation in the body. So what sort of sensation should you feel from acupuncture? Most people will feel one of 5 sensations. In Chinese medicine, we call these 5 sensations like tingling, numbness, a dull ache, a heaviness, or a downwards bearing feeling. In Chinese language, they call that distension, but most Western people don't really use that word distension commonly. So we would say that it's normal to feel one of those feelings or a combination of some of those feelings. And generally what will happen when you come in for a treatment is that the practitioner will ask you if you've had acupuncture before. And if you've had it before, then maybe the way that they do it might be slightly different to the way that you've experienced in the past. But if you've never had acupuncture before and you're a little bit apprehensive of what's going to happen, with my patients, what I'll do is just maybe not do too many needles, just do a few needles and see how you go. And most people can feel a little bit of a sensation the first time they have it, and some patients just feel nothing at all the first time. And that can be totally normal as well. So with most patients who have acupuncture, they should feel a sensation from the experience, but it definitely shouldn't be something that's hurting you. Some people feel overall like a heaviness or a tingliness. Sometimes you can feel something moving up or down the areas. Now, acupuncture needles are inserted into points that we call acupuncture points, and those points connect up to channels or meridians, and those channels connect up to your internal organs. And so it's normal to feel something moving up or down the channel. So for instance, if a point was up in your shoulder up here, you may feel that point, like if it was on the large intestine channel up here, you may feel that sensation going down your arm or into your hand, or sometimes you may feel it on another channel that connects up to that area inside. And so sometimes when a point's put in your shoulder, you may feel something in your knee or feel something in your back. That's quite normal. The other cool thing about acupuncture is once you've had a couple of points in there, usually you start to feel this euphoric sensation or a very relaxing kind of feeling. And so a lot of people really like that because they feel heavy, they feel their mind is relaxed, and they can go into a deep state of sleep. Some people don't sleep, they just lie there and have a relaxing experience. Another question is, how long should the acupuncture take, or how long should I expect to feel these feelings for? Acupuncture techniques vary from practitioner to practitioner, and there's different styles of acupuncture. In some styles, and in styles that probably aren't practiced as much today, the needles were inserted. The chi was obtained, which means you can feel that heavy, tingly, numbness, a dull ache sort of a feeling. And then after that chi was arrived and that you can feel that feeling, the needles were taken out. And you wouldn't lie there and have the relaxation time, you would just do the treatment and then go. Some people still practice like that, and that's totally fine. Other practitioners may leave the needles in between 15 minutes to 20 minutes. Some may be longer, to up to 30 minutes. In China, there's some cases where they would treat people for severe injuries or very, very chronic conditions, and the patients may lay in the hospital. I've seen some patients with the needles left in all day, or even every day they change the needles, and these are particularly points in the head, and for chronic pain or for treating things that are like recovering from stroke and things like that. So the length of the treatment definitely can vary, but the standard treatment time is usually around 20 minutes. Some people will experience a sensation like they've just had enough of the treatment after a certain amount of time. It's usually around 15 to 20 minutes. For some people, if the needles are left in more than 20 minutes, they feel very agitated and they just feel like they want to leave. I usually explain that to patients, like if you do acupuncture on an animal, they usually receive the treatment quite well at the start. They will just relax and lie there. They can become very placid and they just will sit there. Now, once they've had enough of the treatment, if you don't, they'll start to wriggle around and the needles will actually start to come out by themselves. And sometimes little dogs and things like that will just run away because they've just had enough and that's it. They've had enough of the treatment. It's all done now. So humans can be a little bit like that as well. So when you're lying there, if you're having that experience like, oh, I've just had enough of it, or at the very end you feel agitated, you should let your practitioner know so that they can reduce the amount of time they leave the needles in there for. Some patients I've treated, I find that they don't need very long. They only need 10 minutes or 15 minutes and that's enough. Other patients, they really like to lie there for a half an hour and that's fine as well. So you just need, the best way to have a good relationship with acupuncture is to tell your practitioner so that they can understand what's working for you and how you feel. If you feel uncomfortable with it in any way, you should always let them know. Thanks for listening to the podcast and tune in next week for our next episode.